Good morning from New York, everyone. I am very excited for our World Mental Health Day session today. We have some great panelists who are going to be sharing with us their activities and initiatives for World Mental Health Day. And we can't wait to hear from you as well what your respective organizations are doing. My name is Farah Arabi, and I am the founder of itotheN Consulting. I also serve on the board of the Global Mental Health Action Network. I encourage all of you to please introduce yourselves as well in the chat. Tell us your name, what organization you are from, as well as what country you are joining us from. We have an incredible set of panelists. I'm just going to briefly say who they are and then allow them to introduce themselves. We have Nasser Loza, who is president of the World Federation for Mental Health from the UK, joining us. We have Oluwatosin Akingbulu from the Division of Global Communication and Advocacy at UNICEF, the US. We have Wanga Dorji, Executive Director of Lhak-Sam, Bhutan. And we have Deborah Boluwaji Adenikunju, founder of Mental Health KAFE in Nigeria. We will also have Giovanni Sala from the World Health Organization joining us from Switzerland. He's just having a few connectivity issues, but he will be with us soon. So I'm going to now pass on the mic first perhaps to Nasser for his brief introduction.
Right. Well, thank you very much for your kind introduction. Yes, I am president of the World Federation for Mental Health, and that federation has had the responsibility and the honor for choosing the topic of World Mental Health Day since this tradition was established back in the 90s. And when I look at the different topics over the years, it kind of gives you a feel of how priorities and attitudes have changed. What is it we consider? It used to be clinical entities, it used to be child and adolescent psychology, women's mental health, let's fight suicide. And that was important. Today, we've come to realize that the real challenge for a good mental health system in any community or in any country has to do with reducing stigma and therefore increasing access to mental health support systems. And it's a support by the community, not a support for the community, if you see the difference. And therefore, the World Mental Health topic of this year for 2020 being human rights and mental health as a human globally is really very important. If we are able to support the dignity of those of us who suffer with mental illness and our right to be vocal in our societies and our right in self-determination as to what treatments we're going to follow, what attitudes we're going to take. Do we have a say in the management of our system? Do we have a say in the political structure of our countries? Or is it that because I've been labeled as somebody who suffered from mental illness that I'm excluded from all those basic human rights? And right. So I've been very excited to see the response around the world for that particular theme. It really is very heartwarming.
Thank you, Nasser, for that kind introduction. Oluwatosin from UNICEF, could you introduce yourself, please?
Thank you, Farah. Hi, everyone. My name is Tosin, Advocacy Specialist at UNICEF, where I co-lead on the mental health thematic area, and we focus on 4 accelerators. One has to do with increased investment in mental health across different sectors. We also focus on promotion and prevention in the family, mental health in schools, and also fostering positive conversations around mental health, breaking the stigma around mental health. And I also lead on a parenting advocacy partnership with the Lego Foundation, still on mental health. It's a pleasure to meet you, and I'm happy to be part of this conversation. Back to you, Farah.
Thank you. Wanga Dorji from Lhak-Sam, could you please introduce yourself?
Hello, thank you so much for having me on this very important webinar. My name is Wanga Dorji, and I'm speaking from Bhutan. I work for an organization called Lhak-Sam. It literally means altruism, and it is one of its kind network of people living with HIV/AIDS network in the country. And because of the fact that other key affected and vulnerable populations, such as sex workers, drug users, and LGBTIQ people, and other communities. Those are hidden communities, and because of the fact they are they're hidden and also go through lots of human rights issues and stigma and discrimination. And also because of the fact that they are vulnerable to HIV/AIDS, we also work very closely with all this key affected population, in particular, the young key affected population. And because of the fact that it is, health-centered, so we work very closely with the Ministry of Health in terms of reaching out, to this population and reaching out services and, addressing the issues that they are going through. So one of the key, component, programs of our organization is to focus on reducing stigma and discrimination, and in particular, the self-fear and self-stigma and self-discrimination, among the people living with HIV and their affected family members, and in particular, their innocent children. And we do lots of advocacy related to human rights issues, and also partnering with the faith-based organizations and other relevant organizations such as media organization in terms of reducing stigma and discrimination in the society. Thank you so much.
Yeah, thank you, Wanda. Great work. Deborah from Mental Health KAFE.
Awesome. I am the founder of Mental Health KAFE. So I would say largely our mission is to champion change in the mental health narrative and landscape in Africa. So really we do that by creating catalytic collaborations across various sectors, because really the goal for us is to bring mental health to the forefront of the development ecosystem on the continent. We want to see a continental level shift in the mental health landscape. So we do a lot of activities, a lot of strategies across different levels that really address things like capacity building, awareness, education, advocacy. But yes, I am so glad to be here and happy to be a part of this conversation. So thank you for having me.
Thank you, Deborah. And Giovanni Sella from the World Health Organization. Welcome.
Hello, everyone. Thank you very much. A pleasure to be here. I am here on behalf of our director, Deborah Kestel, who couldn't make it, unfortunately, but she sends her regards. I'm a consultant within the director's office of the Department of Mental Health and Substance Use at WHO. I've been involved in organizing World Mental Health Day this year. I'm not a communications expert, but happy to be here. And I'm part-time consultant working within the office of the director, and part-time working on the WHO Special Initiative for Mental Health. Thank you.
Thank you, and welcome to all our panelists. For those of you who are just joining now, we're encouraging everyone to share your name, organization, and where you're joining us from. And of course, in the spirit of learning about what other organizations are doing for World Mental Health, our panelists will be sharing that, but I encourage everyone to share that as well in the chat to identify potential opportunities for collaboration and to elevate each other's work. All right, so now we're going to go into our questions. And because when you arrive last, you speak first, Giovanni, I'm going to start with you. Please tell us, what is the World Health Organization planning for World Mental Health Day, and how can other organizations and individuals get involved both globally and nationally?
Thank you. Thank you very much. So for this year, we are working on a campaign under the slogan of Our Minds, Our Rights. The overall aim of the campaign is to challenge stigma and discrimination and to raise awareness of the importance of good mental health. We want to do this by inspiring collective action toward a world where mental health is fully recognized as a human right and the rights of people with mental health conditions are respected. The specific objectives of the campaign are to share the importance of good mental health, to highlight that mental health is a universal human right, to encourage people to know their rights around mental health, to encourage people to also empower themselves by learning more about how to support their own mental health and that of others, to challenge stigma and discrimination surrounding mental health, as was very importantly mentioned by some of my fellow panelists, and to continuously create connection and empathy around mental health. The campaign itself will have three main approaches, and we are calling them educate, act, and connect. So educate to deliver the background on the importance of good mental health and respect for human rights while raising awareness. Act by focusing specifically on how the public can influence change and encouraging people to learn about their own rights. And connect by showcasing testimonials from people with lived experience, highlighting how respecting mental health rights was central to their personal recovery. Going in a bit more detail, the specific activities that we will be developing this World Mental Health Day are going to begin on 9 October, when we're going to have a launch of new guidance developed by WHO and OHCHR on mental health, human rights, and legislation. It's a very important piece of work that aims to provide information to enable policymakers, lawmakers, and other stakeholders to formulate mental health laws in line with international human rights standards, including, of course, the UN Convention on the Rights of People with Disabilities, or CRPD. Very importantly, this guidance also offers practical information on how to develop, implement, and evaluate mental health-related legislation following a rights-based process. So we're actually going to do an in-person launch event for this guidance with Dr. Tedros Adhanom Ghebreyesus, our Director General at WHO, and Volker Turk, who is the High Commissioner for Human Rights. And then moving on to 10 October and everything else that will surround it, we are going to work, or we're currently working on a social media campaign. We are going to have a video from our Director General himself on World Mental Health Day, and the Director General will also include remarks on World Mental Health Day as part of his weekly press conference. With regards to social media and the toolkit that we are developing, we are going to make available a series of assets and resources on the main WHO campaign page of World Mental Health Day 2023. The toolkit will include social media tiles, videos, web banners, and all these assets will be made available in all UN languages. And the hashtag we will use will be hashtag World Mental Health Day. Now, to answer your final question, how can other organizations get involved? Well, we really want to encourage people to check in on our campaign webpage. The assets and resources will be added there in the run-up to World Mental Health Day, and you are very much welcome to use and adapt them as you deem fit. We really hope that many people can get involved and that it can be useful for many different organizations for their respective users. And we also invite you to check in with what your respective WHO regions are doing, because I'm speaking from the perspective of WHO HQ, but every region also has their own activities that they do around World Mental Health Day. So we do encourage everyone to have a look at what their respective WHO regions are doing around this day. Thank you very much. This was a brief summary of what we are doing. Please feel free to ask any questions. I'm also joined today by my colleague Laura Kelleher from the Department of Communications, who can also answer any questions in the chat. Thank you.
Thank you, Giovanni. It looks like there's a lot of opportunity to collaborate, especially around social media efforts. So I hope our audience will engage with that. I think also Divya has put the link on the chat for those of you who are interested in seeing more about the World Health Organization's campaign on Our Minds, Our Rights. Thank you, Giovanni. All right, now I would like to pass on the mic to Nasser. Nasser, this year's theme is mental health as a universal human right, as Giovanni was mentioning. What is the World Federation for Mental Health planning for World Mental Health Day? And how can other organizations get involved?
Oh, this is quite an event and quite a year for us, because we're not only planning for World Mental Health Day, but on that same day, we're celebrating 75 years since the birth of the World Federation for Mental Health, and actually the WHO the same year. It all happened after the Second World War in 1948. So it's really important that we look through. So we're having, yes, a big event. I mean, there are endless number of events on October 10th. And thank you as an organization for starting this earlier, because as we get closer to October 10th, I think nearly in every country in the world, there seems to be an activity for advocacy and for anti-stigma that's getting louder and louder. I think choosing the theme and using the word human rights is an important, has really helped us here. People feel they need the right, they need to be empowered. And it's the message is, you know, we've had a lot of voices of professionals, of mental health professionals of different kinds. What we need now is the voice of people with mental health issues, as carers, families with problems, families who have a family member of Alzheimer's. The plight of these people really justifies that they should have a voice, that they should have a right to do that. So to ask me what we're doing, well, there's a big celebration in Geneva at WHO celebrating 75 years. That, in fact, is on November the 17th that it takes place. But then there are a lot of regional celebrations in October coming up. And I think people are becoming more aware of the difference between mental health and its advocacy as opposed to mental illness and its treatment. So on Thursday, I'm flying to Vienna because there's this big conference of the World Psychiatric Association. And I think professional associations have come aboard now. They've all joined into recognizing the important role of mental health advocacy. So to answer your question, there's a lot happening there. There's a lot happening globally. There's a lot happening with collaboration with WHO and other UN organizations, and with the professional organizations. The psychiatric organizations globally have been amazingly supportive as well. Thank you.
Thank you, Nasser. How can people around the world support the efforts of the World Federation for Mental Health?
Well, what we need, you're right, it doesn't need the World Mental Health Day to do that. It just needs people who are keen to change minds of others. And I think if I looked around where I live in London or in Cairo or wherever, there will be people who've had or who've lived very closely, or a family member or a loved one with mental illness. Now, we all need to go on now. We all need to create blogs. We all need to tell our stories. And this could be done on every level. You know, it's fine to invite your psychologists and psychiatrists to talk, but invite your politicians maybe. What's very impactful is that you have an actor, an actress, or an artist, a musician who've had mental health issues, either themselves or close to them. They reach out. I find, of course, the most impactful one of all is football players. They're amazing. You know, they reach much further than any politician or any doctor, I tell you, in their hearts. But what we can do, what can we all do at home, and what we can all do in our own associations globally, is do that. Bring the voice of those who've suffered from mental health problems louder. Create blogs, create, you know, videos, share those around, and it's very often you do these. You get children of somebody who suffered from bipolar disorder, schizophrenia. They need to talk about those experiences. They need to be heard. And once they're heard, it would gradually become not only a usual or a common thing, but it'd be an honorable thing to do. That, you know, the fact that I lived with a mother who suffered from bipolar disorder is something that I want to talk about and share. And of course, this is the best thing to do. So that's the way to do it, and that's the way forward. And let's not stop on World Mental Health Day. Let's go on 365 days a year.
Wonderful message. Thank you, Nasser. Yeah. Let's speak about our stories. Let's tell a little more about what it means to have to deal with mental health, and especially if you're a football player, of course.
Yeah. But you know what I can ask you? I'm not sure if we have educators among us today, But one thing that we've done very successfully a couple of years ago back in Egypt is asked students at every level, from mass comm students to elementary school students, to go into a competition whereby they draft a mental health campaign. They think, the students themselves, how is it that we're going to have a campaign to change people's mind about mental illness? Now that, when there's a competition and a prize and a certificate and a recognition, you get those young people to want to change their minds, and they probably think much better than many of people my age, and it spreads the ball rolling. It does.
Absolutely, yes. And that is a great segue to our next panelist, who focuses on the young human beings on the world. itotheN from UNICEF. I'm very excited to hear your remarks on what UNICEF is doing or planning for World Mental Health Day, and how can other organizations get involved, again, both globally and nationally.
Thanks, Farah. So I'll give a quick overview for the mental health activation in October, which includes World Mental Health Day, of course. UNICEF will be expanding on our successful On My Mind campaign, and we're going to be using two mutually reinforcing approaches. The first one will be on strategic advocacy, where we're going to be targeting decision makers to make commitments to children, adolescents, and caregivers on mental health. And the second approach will be strategic communication, which will be targeting young people themselves, but also caregivers as a secondary audience, to promote good mental health, also helping them have a greater knowledge of the importance of emotional regulation, of managing stress, and lots of the mental health issues that young people face today. Now, on specific advocacy activities for this year, UNICEF and the World Health Organization will be coordinating plenary sessions and workshops at the Global Mental Health Summit in Argentina, and that will take place from the 5th to 6th of October. And the theme for that summit is mental health in all policies. At that summit, there will be a focus on centering youth, and adolescents and caregiver voices. And it will also be an opportunity to bring together ministers across different sectors, to ensure that they are committing to mental health, also in line with our key advocacy aspects. And also before that summit happens, we're going to be hosting a youth mental health forum also in Argentina, where we're going to be encouraging young people, to also talk about mental health and to involve them in this advocacy effort. On the sidelines of that, UNICEF will also be supporting the European Commission with a high-level conference on mental health that will be taking place on October 10th in Brussels. Now, how can our partners get involved? We urge you all to amplify our assets and content around World Mental Health Day using the hashtag #OnMyMind. We've developed an advocacy and communications toolkit, which we can share, after this webinar with the network. And this outlines all the top line key messages, tons of digital assets that can be used, and also resources that can support advocacy efforts and also support you to deliver original and localized content. Now we have a social media pack included in that toolkit. We have lots of multimedia assets. We have lots of articles that can be used on websites and blogs. We also have youth engagement resources, via our U-Report chatbot. Now, the U-Report chatbot is one of UNICEF's social messaging tools that reaches millions of youth, I think close to about 20 million now. And we also have the Voices of Youth website. So we're going to be leveraging all of that, including the voices and platforms of some of our goodwill ambassadors, such as Orlando Bloom, and some of our digital influencers who are partnering with us as well, asking them to share, their personal mental health stories and also share tips, of how they are able to overcome some of these challenges. Now, some of the other things that you can do is, if your government is attending the Global Mental Health Summit in Argentina, you may consider engaging them with a follow-up presentation or event. If they've made a commitment, for instance, this could be something that could be highlighted across different fora or on social media if appropriate. Another thing you could do is also organize a webinar or talk, just like this one we're having, leveraging some of the mental health resources that have been provided, and also connecting experts to young people, connecting experts to parents and caregivers, and also the wider community as well. And this could help open, a dialogue around mental health in a way that is positive and in a way that is non-stigmatizing. Now, I think it's important that we share and amplify each other's messages because it's crucial, that our networks, our leverage, they are incredible assets that can help spread our advocacy messages on mental health. And we've seen that the people in our network, can help circulate these messages further by sharing with their own network, which can now cause a ripple effect to increase our reach and impact. And yeah, on this note, I'll hand over to you, Farah. I'm happy to take any questions, comments, or reactions from the audience. Thank you.
Thank you so much, Oluwatosin. It's very exciting to see opportunities for engagement, not only within social media, but also following up the conference in Argentina or in Brussels, to follow up with our government leaders, to conduct webinars in a way to hold all of us accountable for any support, any efforts that are supported in the conference. So thank you for that, Oluwatosin. We're going to go now to our next speaker, Wanda. Tell us, please, how have your plans for World Mental Health Day evolved over the years? And what do you hope to achieve through this year's campaign?
Thank you so much. As of now, I think as an organization, we have never ever, actually observed a mental health day in the country. So actually, the Minister of Health, should be, observing this mental health day, and they should be actually inviting all the key affected populations and other communities that are vulnerable to mental health issues. But this was not really taken up from the government itself. Now the the PEMA Secretariat, we call it the PEMA Center. So they are now going to establish a well-functioning mental health center, so that will cater responsive services, including protection and then reintegration services, providing with rehabilitation and detoxification services. But as of now, in Bhutan, I don't remember that, we have, conducted or observed a mental health day in Bhutan. So, I even don't remember, when is the mental health day event, because this was never ever, observed in Bhutan. So, I learned only today that, mental health day, event is going to be on October. But I would like to inform that, on October, we have a program whereby all these key affected populations, we are going to come together and we are going to invite people from the policymakers, from the ministries, and also from the, other relevant, partners and stakeholders, including from the UN agencies. And also we are planning to invite people from the PEMA Secretariat itself. And then we are going to present the issues that are being faced by this key affected population, including the people living with HIV, sex workers, drug users, and the LGBTIQ people. Because we have, already built up an evidence, to present to the policymakers on the issues of stigma and discrimination, on the issues of, human rights, which further aggravates self-stigma and self-fear among these key affected populations, including among, as I've mentioned, the innocent children, that are born to the HIV positive parents, but, are HIV negative. And all those, including, children, are going through lots of stigma and discrimination, because of the fact that we don't have such program. And what I can remember is that in the country, we only have 2 psychiatrists, and most of the time, one will be on royal duty or maybe on official duty. So we can say that there is only one psychiatrist. And for the detoxification center, there is no good detoxification center. But as I've mentioned, now the PEMA secretariat is going to come up, and they say that it will be ready by only 2026. But as of now, as I've mentioned, they provide this responsive services such as helpline services, case management, and post-ventilation services to the families and then the friends affected by the suicides. And I have to mention that Bhutan is I think in 3-4 years back, the Prime Minister himself presented that Bhutan stands at the 25th country in the world with highest number of suicide cases. And recently we have also been able to conduct a study among the people living with HIV and their affected family members. So this study was conducted after 29 years of HIV epidemic in the country. So we used the WHO quality of life, questionnaire, and including we have added some indicators to find out. But the study, revealed that, the stigma and discrimination is, less than 10% of the global, AIDS strategy. So what I should say is that stigma and discrimination in Bhutan is quite challenging. As a person living with HIV, I was detected living with HIV in 2006. And, for me, more than dying from AIDS, that time my fear was, facing stigma and discrimination. Yeah. So this stigma and discrimination, so related to AIDS, related to gender, related to identity, related to your dependence on drug and alcohol, and also on your, sex professions, so all, these key affected populations, in particular, the young key affected populations are really going through, stigma and discrimination from the society, because societies are not well informed, they are not educated. And whereas the communities cannot inform the society and the communities in a more comprehensive manner. Why? Because the communities are not trained, their capacities are not built. Although we have been doing these mental health issues, human rights related issues, responding to all these challenges and issues faced by this key affected population and people living with HIV, including their self-fear and self-stigmatization, which is more important because one of the factor is the external stigma and discrimination. And in particular for Bhutan, I don't know with other countries, but in particular for Bhutan, the AIDS-related stigma and discrimination came from the past global advocacy on HIV/AIDS. AIDS is a deadly disease. AIDS is a killer. If you have AIDS, then you are almost like you have already obtained a death certificate. So that's sort of an advocacy, past global advocacy, putting fear into the society, has actually aimed this, fear into the subconscious mind of the society. And now it has become a habit for them to fear, to distrust, to deny love and care for each other, and stigmatize and discriminate. So it's further aggravating the fear, and it is deteriorating the quality of life among the people living with HIV and other key affected and vulnerable population in the country. So I am very much confident that the PEMA Secretariat will, take this, endeavor further in terms of, taking care of the issues of mental health of the Bhutanese population. And, it is quite unique, comparing to other countries because of the fact that Bhutan, has a very small population of around 700,000 people. So once you are LGBTIQ or sex workers or people living with HIV, or you are the children of those key affected population, you are already marked and recognized by the society, and it becomes very easy for them to stigmatize and discriminate. whereas there are no services available to, help, to assist, and to guide these people, apart from the peer counseling. Of course, the peer counseling, is more profound, than many of the, the counseling that's provided by the psychiatrists themselves. So one of the things that we use is strategy that we use is to use peer counseling, console someone, try to suppress the fear in someone, shame, guilt through our own experiences of having gone through that sort of, issues and how we have overcome it, and how we have, actually faced those challenges. So basically, in Bhutan, specifically when it comes to mental health issues, addressing the mental health issues, the basic strategy that we use, because that is the only available, services that we have, is providing the peer counseling. And then through our own experiences of being LGBTIQ, sex worker, drug users, and people living with HIV, we go into the society, into the community, sharing our own experience, of having gone through those challenges and how we have overcome it, and how, when someone stigmatizes or discriminates, this key affected population, and what challenges that they go through, including, early school dropouts, use, going into dependent on drug and alcohol, and ultimately, committing suicide, right? So those sort of experiences that we share, and including, we work very closely with the religious organization. So using religious organization to reduce stigma and discrimination in the society, because most of the stigma and discrimination also comes from the religion, through the ancient text, through the ancient script and traditions and dogmas. So that's why we work very closely with, the religious organization, especially when it comes to karma, the sin of being people living with HIV, being the key affected population, is seen through the religion. So we work very closely with them to, sort out how they have influenced the society. Mm-hmm. So, thank you so much. I will stop here.
Thank you so much, Wanda. I think you have perfectly illustrated how, even though there can be a top-down support for mental health in a place like Bhutan that has a gross national happiness index, we still need multi-stakeholder partnerships from religious organizations, from communities, and most importantly, that human connection, right? The peer counseling, as similar to what Nasser was saying, let's share our stories. Now, last but not least, I want to pass on the baton to Deborah from Mental Health KAFE.
Awesome. Thanks, Farah. I wasn't sure if you wanted me to just generally speak or if you had a specific question.
Sorry. Yes. Well, I do have a specific question, Deborah, for you. What can you tell us about your brand new mental health resource map for the African continent? And how can others contribute to this?
Thank you, Farah. So to get started, I would like to provide a bit more background, so which would pretty much give you a better idea of what our why is. I think that I want to say anyone on this call, anyone who is in the space of mental health on the continent or reads about it, does research around it, you're not surprised when you hear data that's stating, 0.0001, like psychiatrists to every 100,000 individuals. Like these are things that we so often hear about, or hearing that there's an entire African country without a single psychiatrist. These are stats that I'm so used to hearing about all the time. I mean, outside of the qualitative or the quantitative data, there's also the anecdotal evidence, right? It's typically having to meet individuals with lived experience and having them tell you, oh, I'm in my community and I have no one to help me. There's no one who understands what I'm going through. I want the support, but there's nothing happening. And this, obviously, as a global mental health professional, this has bothered me a lot. But on the flip side of it, in being in this space for so many years, I've also met so many amazing individuals on the continent doing this work. I mean, I have met individuals who are so passionate, so committed. And I'm talking about grassroots organizations. I'm talking about individuals who are trying to do work around advocacy, research, policy. So it became the question for me and my team of what is the problem here? On one end, we know that there is an issue of resources, both human and funding on the African continent to address the mental health needs. But on the other hand, we know that there are in fact individuals who are doing this work, who want to support their communities. So it became a question for me and my team. It's like, how do we bridge that gap? So yes, we know there's a scarcity, but when we do have resources available, how do we spotlight those organizations, those individuals doing this work? How do we connect individuals? Research shows that there is a direct link between increase in awareness and utilization, right? So now we're talking about mental health promotion on the continent, and we're saying, okay, what can we do to actually get people to the resources that are available? I think given since COVID happened, we've seen so much innovation around digital health. But outside of that, we've seen how technology has been used to advance so many different, I want to say, sectors across the globe, but on the African continent specifically. So I'm asking myself, if an individual can sit and just by looking at their mobile phone can find the closest restaurants, the best dancing spots, the best place to go, I don't know, watch sports, why can't a mother who is trying to find the closest special ed schools for her kid on the autism spectrum, why can't she have the same thing? Why is it that someone who is in the space of distress and needs an emergency response because they're feeling suicidal, why shouldn't there be a way for them to go to a similar resource map and say mental health or suicide prevention? Why isn't that available for individuals on the continent? So it became a charge for me and my team to address that specific need. We want to make sure that individuals on the continent, regardless of who they are, where they are, what their needs are, they have a place to get them started. There's been so much work around awareness and education on the African continent around mental health. And I've been so happy to see that, because now we're seeing that people have the language to be able to describe what they're going through. People now understand and can talk about gender-based violence. They can talk about neurodevelopmental disabilities. They can talk about substance use disorders. But then we're giving them the awareness and the language, but where's access to the resources? How do they know about the resources that are actually available to them? And we thought that was a really big gap that had to be addressed. And we wanted to step in to do that. So what my team and I have done is come together to actually start to compile a list of mental health resources across the African continent. So what this means is we're collecting resources from research institutions, right? Like organizations, and saying, here are individuals doing research on the continent for us, by us. These are people who are looking at, research and interventions, implementing them on the African continent, learn about what they're doing. Here are institutions on the continent providing trainings for capacity building, learn about them. For individuals looking for organizations to provide direct services, here you go. From advocacy to policy to rehabilitation services, here you go. But what this does is that it gives individuals a starting point. As a person with lived experience, I know how overwhelming it can be to finally want to start that journey towards mental health, just your own personal well-being, and not knowing where to start from. I think oftentimes we forget that as mental health professionals, that we have the language. We know the resources, we know how people describe different things, but we forget that for a typical person in rural Uganda, they might not have that same language. So what we did is come up with a search of a list of search terms for different mental health related organizations and mental health conditions, and we started compiling a list. So again, from looking at from Southern African to Western African to Central Africa, we want to make sure that if you're on the continent, regardless of what your need is, you have this spot to start. So we're hoping that this resource map becomes a beacon of hope for those who are not sure where to start from, for those who are simply even curious. We're talking about kids in school who are saying, hey, this is a need I want to address in my community. I'm curious, what are different services that I can actually provide? What are different ways to learn more about this? But to your question about how people can get involved, we are launching this map October 10th, which is World Mental Health Day. And we are so thrilled and excited about this. But we can't do this alone. I cannot overemphasize this, that this is a collective effort. So when that map goes live, I would encourage individuals, please follow us on our social media platforms, go on our website. We'll be making a huge announcement when it goes live. But what you can do as an organization, as an individual, as an ally, an advocate, or someone who is simply just curious, is share this map. You have no idea whose life can be impacted as a result of that. Share the map, provide us with your feedback. We want to know, is it user-friendly? We want to know what resources were actually helpful to you. We want to know how to make this resource better for Africans on the continent. So we encourage individuals to send us their feedback. And another side of it would be, there's going to be a form to fill out to pretty much give us information about your organization. We can only do so much. We've spent months searching for organization. We've spent months searching for these resources, but we know that there's so many more out there. We couldn't capture everything, but we want to. We want this to be as comprehensive as it can possibly get, but we need your help to do that. So whether you're sharing the resource or you're filling it out for your own organization, or you're sending it to someone in your community that's doing amazing work, but it's not featured, let us know what's happening. I also want to just point out that earlier this month, actually, for World Suicide Prevention Day, we decided to actually release a different map. That's the Africa Suicide Prevention Map. And the reason for that was in line with the theme of creating hope through action. We understand that for individuals going in distress, needing emergency response, that they might need something a little bit more targeted. So we actually decided to have a map that's specific for suicide prevention, and then a more comprehensive general resource map. So we would encourage individuals to go on our website, check out that suicide prevention resource map. That is live right now. There is a form in case you are not featured on that map and you do provide relevant services for individuals going through distress. Please fill out the form and let us know, and we would be happy to feature you on there. But that is all from me at this point. But again, this is a call to action. We're asking individuals to be engaged, to really own this, because we're all in this together at the end of the day, and we're hoping that we can all stand up as one people to say, yes, we are here to transform this continent and to create a mentally healthy Africa. Thank you.
Bravo, Deborah. That was pretty amazing. I saw a lot of hearts and claps popping up in our screen. It's a very pragmatic approach to helping the world with mental health. And I hope that has inspired many of the organizations in this call to either follow something similar or support your current efforts. So thank you. We have very little time to address some of the questions that have come up in the chat, but I'm going to begin right away. I will suggest someone to respond it, but if anyone else has any thoughts, please jump in. So what is being done to persuade families regarding family therapy? Actually, there's a cultural stigma and also a feeling of shame on every member of the family. Very interesting question. I think Oluwatosin, you were talking about caregivers as well as children. Deborah was talking about mothers as well. If anyone has any thoughts on how do we persuade families to pursue family therapy when needed?
Thanks, Farah. I can comment quickly on UNICEF's work in that space. So as I said earlier, one of our accelerators under the mental health a global advocacy priority area is promotion and prevention in the family. The angle at which we address this from is to advocate for governments, and stakeholders to invest in universal access to parenting support programs. So basically what we want to see is that every family everywhere, irrespective of your economic situation or geographical location, is able to access some kind of parenting support, especially when their children are still in those early years, from, pregnancy through, the first 1,000 days, even and beyond that. So that's basically what we are doing now. And we've been working closely with a few champion countries, hopefully to expand that. Our goal is by 2025, we want to see at least 25 more countries, implementing these parenting support programs. And it could be different. It's not a one-size-fits-all. It's not a single approach that will work for all the different contexts. We know that what parenting support could look like in a place like the UK will be different from in a place like Nigeria, where I come from. So we're definitely just working with our partners on the ground and governments as well to see how they can integrate this into already existing programs. Could be in the health services, could be in the education sector, could be in the community volunteer networks, and see how this can continue and be sustainable over the years as well. Thanks, Farah.
Wonderful. Thank you, itotheN. Quickly moving on to our next question. As Nasser, Wangda, and I think everyone here has mentioned, or at least briefly, there is an importance to sharing our stories, right? Especially people with lived experience. So a question is, what can be done? What actions can be taken in order for more persons with lived experience to speak out? And how can we amplify the voices of people with lived experience, especially in World Mental Health Day, which is the context in which we are speaking today?
If I can add to this, really, it's by giving an example, by setting the example, by us speaking about our own experience. There are, I'm looking here, some 76 attendees in this meeting. Of those, at least 20 have had, 20 of us here today have had some mental health problems. I think we should be open about it. We should give our testimonials. We should set the example and then bring in community leaders, religious leaders, actors, football players, as I say, politicians. Everyone could share their own experience, and testimonials are the most powerful effect on people and on the communities. So that's the way I suggest we go.
Excellent, Nasser. Anyone else has any thoughts on this question? Would like to add anything?
If I can add very quickly, this is very much a priority for WHO around the world, and some colleagues of mine are actually working on a guidance for the development of policies and plans at the moment. And there's a whole section on the involvement of people with lived experience of mental health conditions, and there's lots of stuff that really can be done at different levels, but especially at governmental level. Some of these things, just to name a few, are to employ people with lived experience in government departments responsible for mental health, of course, but also to engage them in advisory boards and working groups at different levels of government around mental health to support the costs or cover the incurred expenses of their involvement and engagement, whether that be travel or anything related. But also, very importantly, in the long term, to establish mechanisms to allow independent financing for civil society organizations and organizations representing people with lived experience of mental health conditions. At a more technical level, it's important to draft guidelines of different kinds in different countries for and with the representation of people with lived experience in services, and incentivize actions to increase the representation of people with lived experience in service delivery, training initiatives, and research, of course. It's important to engage people with lived experience to prepare campaigns and advocacy and to support awareness-raising effort, and very importantly, to work with traditional and social media to report responsibly on the work and lives of people with lived experience of mental health conditions and psychosocial disability, and to educate against stereotypes and human rights violations with persons with lived experience leading this work.
All right, if it's okay, if I can just quickly chime in with one thing. I think it's also important to remember the different platforms that are available. I think oftentimes when we ask individuals with lived experience to talk about what they've been through and really shed light on their stories, we have to understand again, different contexts where different people are coming from, different age groups. And I want to speak specifically towards the youth. So I think it's very important that we understand communicating at a high level, for example, like having policy briefs and having campaigns, but it's also important that we think through, how do we create an environment, both physical and social? How do we have platforms that actually encourage, again, I'm focusing on the youth, for them to be able to use what they are used to, the way they want to express themselves, again, by stepping into like what is even within them, their own context, their own culture, to tell their story. So that is something that Mental Health Cafe is working on for next year. So keep an eye out on that. But I think it's very important that we identify avenues that speak to individuals who lived experience. So it's not really about how we want them to tell their story. You know, we're asking, hey, write a report, send us a feedback. It's how do they want to tell their story in a way that actually captures their own background, their culture, the people around it, their community. How can they authentically tell their story, which means they would have to lead. And sometimes that's tricky because we want to create the guidelines and the strategies. And sometimes many of these individuals, especially youths, want to step outside of that. And they want to express themselves the way that they feel most comfortable. And it's making sure that we're creating room for that to happen. Thank you.
Thanks, Deborah. Yes, and in that spirit of how do we make action happen and how can we be most impactful, I'm going to move on to our final round of comments. In the tradition of the Global Mental Health Action Network, we usually close out our events with a round of tweet-sized comments. So I would say 30 seconds or so per speaker. I guess I should now call it X instead of tweet, but you guys know what I'm saying. And you will answer, please, the following question. Okay, so to drive meaningful action on World Mental Health Day, we must, and I will start with Giovanni.
Thank you, Farah. I think to drive meaningful action on World Mental Health Day, we must all take the individual responsibility to raise awareness around mental health and promote mental health as a fundamental human right.
Bravo. Nasser?
So, Mike's on, yeah. I like to think it's not just Mental Health Day, no Mental Health Week, no Mental Health Month or year. It should be every day. It should be a continuous movement that's empowered by people who've set this as a priority in their lives.
Absolutely. Wanda?
We need to build the capacity, and then we need to empower the community themselves to, challenge and then, respond to the mental health issues in their own countries.
Localization, that's right. Oluwatosin?
Thanks, Farah. To drive meaningful action on World Mental Health Day, we must rally with one voice to call for increased investment in mental health, and also to promote positive conversations among young people, but also caregivers as well, and the wider community to support good mental health and well-being. Thanks.
Finally, Deborah.
Right, so to drive meaningful action on World Mental Health Day, I would say that we must center and prioritize equitable partnerships globally, nationally, and locally. Thank you.
Thank you, Deborah. And hopefully events like today's will help connect us at all levels, as you are mentioning. I want to thank our panelists today for joining us. I want to thank the audience also for joining us as well. Please remember that this conversation continues in Circle. For those of you who are not a part of it yet, Divya from GMAN has put a link on the chat. We'd love to hear about what you have planned for World Mental Health Day. And Circle is a great way to do that and a great way to connect. Thank you all. Just also a brief reminder that our next World Mental Health Day is World Mental Health webinar will be on World Mental Health Day reflections. So we're going to be discussing what was achieved and debriefing on our afterthoughts after World Mental Health Day. Thank you so much again, everyone, for joining, and I hope you all have a wonderful day. Bye. Thank you.
Thank you. Bye.
Thank you, everyone. Bye-bye.